You are watching the Nightly News with Christopher P. Smith, and now a special report. This, I will discuss the different circumstances in which both weight loss and gain occur. I will also discuss the pros and cons of both events depending on the individual. I will then conclude on what we as individuals can do to maintain a healthy weight and optimize our musculoskeletal and endocrine systems. There was a study conducted in 2015 to 2016. 81 female undergraduate students with obesity completed 4 open-ended questions. Most participants experienced weight gain prior to attending college. The most reported reasons for weight gain include a lack of ability to control one's behavior or overcome barriers, i.e., poor eating habits, lack of physical activity, lack of time and easy access to food, emotional and mental health issues, physical health, and influence of significant others. Nearly half reported having a weight loss goal. Most reported having used one or more weight loss methods. A few achieved short-term weight loss but quickly regained the lost weight. A majority reported barriers reflected a lack of self-regulation skills, negative mood and stress, and lack of self-efficacy for healthy eating or physical activity. The conclusions. Results suggest that the perceived ability to control one's behaviors and overcome barriers, self-efficacy, and mood are important in weight-related behaviors, weight and weight loss success among emerging adults, especially those enrolled in college. Reasons why you may be gaining weight. You're eating right, you're exercising, you're doing all the things. So why won't your pants button? As maddening as these stubborn pounds can be, identifying your issue will help you lose them in no time. It is understandable when you gain a few pounds after vacation, or if you broke your ankle and spend 6 weeks propped up on the sofa binge watching cartoons or playing Xbox. Most likely there's something in your life that has shifted just enough to make a difference, but not so much that you would notice, says Alexandra Soa, MD, an obesity specialist and clinical instructor of medicine at NYU Langone Health. I see this all the time, and you may not step on the scale for a while and you feel like you haven't changed anything, and all of a sudden you go into the doctor's office and notice you've gained 10 or 20 pounds. Your insulin may be out of order. Insulin is the hormone that signals the body to pull glucose from the bloodstream and store it in muscles, liver, and fat, says Teresa Reed, MD and obesity medicine specialist at Columbia University Medical Center. But when you're overweight, cells may not respond to the insulin as well. They're resistant, so the pancreas has to pump out more insulin to maintain a normal blood sugar. High insulin levels keep the body in storage mode and make weight loss more difficult. Stress and exhaustion are slowing your metabolism. If you're up at night worrying about your final exams, social media posts that have gotten under your skin, or having your favorite news channel bombarding you with negative news, understand this. Stress and lack of sleep can cause a cascade of hormonal changes that alter your metabolism and affect your sense of hunger and fullness, Dr. Soa explains. Stress pumps up the hormones ghrelin and cortisol, which increase your appetite and can make you crave carbs, while dialing down the hormone leptin, which helps you feel full. Stress also hinders sleep, which further throws off metabolism rates and hunger cues. Your allergy pills may be making you fat. We're not 100% sure why, but it's believed that histamines, the chemicals produced by your body's immune system to fight allergens, have a role in appetite control, says Dr. Reed. This means antihistamines may cause you to eat more, she says. A large study from Yale University confirmed a correlation between regular prescription antihistamine use and obesity. Dr. Reed points out that some histamines may also cause drowsiness, which could make you less apt to exercise. Your healthy food is packed with calories. Veronique Provencher, PhD, a professor of nutrition at the University Laval in Quebec City, Canada, says you could be eating the cleanest, organic, dietitian-approved, plant-based, or ethically farmed food, but that doesn't mean the calories transform into pixie dust. In fact, results have shown that when you are eating something healthy, part of your attention to fullness tends to turn off. In several studies, we have found that when we perceive a food as healthy, it creates a bias in our judgment, and we may think, consciously or not, we can eat more of it, no problem. We think a salad is healthy, so we feel we can eat as much as we want with as many dressings or toppings as we want. Obesity can be associated with several endocrine alterations arising from changes in the hypothalamic pituitary hormones. These include hypothyroidism, Cushing's disease, hypogonadism, and growth hormone deficiency. Besides its role in energy storage, adipose tissue has many other essential functions that can be mediated through hormones or substances synthesized and released as adipocytes, including leptin and adiponectin. Further, obesity is also a common feature of polycystic ovarian syndrome, with hyperinsulinemia being a primary etiological factor. Rapid weight loss. The nutcracker phenomenon, or left renal vein entrapment syndrome, occurs when there's compression of the LRV, mostly between the abdominal aorta and superior mesenteric artery. Patients with NCS may present with various symptoms, with the most common being hematuria, left flank pain, varicocele in males, proteinuria, and anemia. Some studies have proposed a relationship between rapid weight loss in a brief period and the appearances of NCS. We recommend that healthcare providers suspect NCS in patients who present an upbrought severe abdominal discomfort, particularly in situations that coincide with rapid weight loss for unknown reasons. Severe food restriction is a common dieting strategy for rapid weight loss. What is the central question of this particular study? What were the effects of a 2-week period of severe food restriction on vascular reactivity of resistant arteries on a cardiac structure and function? In one study, male Fisher rats were maintained on a controlled diet and an SFR, which is 40% of the controlled diet intake, for 14 days to mimic low-calorie crash diets. These findings in rats warrant a study of cardiovascular function in individuals who engage in extreme dieting or are subjected to bouts of exceptionally low uh, caloric intake for other reasons, such as socio-economical factors and natural disasters. A 2-week period of severe food restriction in adult fisher males caused endothelial dysfunction on the mesenteric arteries and increased the susceptibility of ischemia, reperfusion-induced arrhythmias, and cardiac pathology. The findings of this study might have ramifications for cardiovascular risk in people who experience periods of inadequate calorie intake. Congenital hypothyroidism occurs when the thyroid gland produces too much of the hormone thyroxine, which can accelerate body metabolism, causing unintentional weight loss and rapid or irregular heartbeat. Hypothyroidism is exceedingly rare and its prevalence is unknown. Common clinical features include unintentional weight loss, tachycardia, arrhythmia, palpitations, anxiety, tremors, and sweating. The weight gain that leads to obesity is the consequence of a positive energy balance, which can result from an increased energy intake, decreased energy expenditure, or both. This misalignment may be thought of as a failure of the body's homeostatic mechanisms to match energy intake with expenditure. Adipose tissue has many important functions other than energy storage that are mediated through hormones or substances synthesized and released by adipocytes. These substances, termed adipocytokines, act on distant targets in an endocrine fashion or locally in a paracrine and autocrine fashions. Adiponectin is another important adipocytokine that influences insulin sensitivity and atherogenesis. It reduces hepatic glucose production, increases the utilization of glucose and fatty acids by skeletal muscles, and lowers blood glucose levels. In addition to an anti-atherogenic effect, adiponectin may also have a variety of anti-tumor effects. This is thought to be mediated in part through inhibition of leptin-induced tumor proliferation. It retards the aggressiveness of tumors and their metastatic potential. By cancer site and type, high adiponectin levels are associated with decreased risk of breast, colorectal, and endometrial cancer, whereas hypoadiponectinemia has been associated with increased risk for breast, gastric, lung, and prostate cancers. Weight loss is associated with a decrease of camerin levels and, like adiponectin, an improvement of all parameters of the metabolic syndrome. Also, a decrease in camerin is independently associated with the reduction of carotid intima media thickening and improvement of insulin sensitivity. The hormone leptin is how adipose tissue communicates with other systems in the body, in particular with the central nervous system. Following release into the circulation, leptin crosses the blood-brain barrier and binds to presynaptic of the hypothalamus of the central nervous system, controlling appetite and energy expenditure. One of leptin's key roles is thought to be a signal for inadequate food intake or starvation. For example, leptin levels decline during fasting, low-calorie dieting, and uncontrolled type 1 diabetes. In these situations, the reduced leptin levels stimulate hunger while decreasing energy expenditure and engendering other physiologic adaptations that restore fat stores and in turn leptin levels to baseline. As a regulatory signal in a homeostatic system, if the leptin receptor is functioning normally, then higher circulating leptin levels should result in decreasing energy and intake and elevated energy expenditure. But this is not the case when individuals become overweight or obese. Instead, in patients with obesity, high level leptin levels are associated with low circulating soluble leptin receptors. Omentin is an adipokine preferentially produced by visceral adipose tissue that exerts insulin sensitizing actions. Retinol binding protein 4 belongs to the lipocalin family that transports small hydrophobic molecules and is produced primarily in the liver and mature adipocytes. Although the relationship between serum RBP4 and obesity in humans has not been confirmed, yet in population studies, several studies have shown positive correlations between the expression of RBP4 and BMI and glucose concentrations. Vaspin is considered an anti-atherogenic insulin sensitizing factor. Fatty acid binding proteins. It binds to hydrophobic ligands such as long-chain fatty acids and facilitates their transport to specific cell compartments. Acylation stimulating protein. It has been shown to induce glucose-stimulated insulin release from pancreatic beta cells, modulate cytokine synthesis by mononuclear cells, as well as inhibit cytotoxicity of natural killer cells. Adipose tissue is an extremely active organ with multiple roles, including endocrine, patocrine, and autocrine in human physiology and disease. How these roles are performed and their contributions to the health or risk of disease will likely be elucidated as more discoveries continue to shed light on the mechanism of the complex interaction between adipocytes and other body tissues. Estrogens play an important role in body weight, fat distribution, energy expenditure, and metabolism. Thyroid dysfunction is frequently associated with changes in body weight and composition, body temperature, energy expenditure, food intake, glucose, and lipids metabolism. Hypothyroidism is linked to weight gain and decreased metabolic rate, but there is also a positive association across the normal range between certain levels of TSH and BMI. Optimizing your body. Switching to foods with a lower glycemic index, which means they are digested more slowly, keeping the blood sugar steady, is also important for controlling your insulin levels. Dr. Soil recommends these food swaps: rice cauliflower instead of white rice, zucchini spirals or shiitake noodles made from plant fiber instead of pasta, and pumpernickel or stone ground whole wheat bread instead of white bread or bagels. You can manage your stress with an app such as Sanvelo, formerly Pacifica, which offers meditations and can help you work toward anxiety-reducing goals such as thinking positively. To sleep more soundly, you should put down your devices an hour before bedtime. A study at Northwestern University Feinberg School of Medicine found that after subjects spent just one night sleeping in a room with dim light, their insulin levels the next morning were significantly higher than those of people who slept in complete darkness, potentially affecting their metabolism rates. Consider buying blackout curtains. Jeffrey Demain, MD, founder of the Allergy, Asthma, and Immunology Center of Alaska suggests talking to your allergist about alternatives such as nasal steroid sprays, nasal antihistamines, which have less effect on hunger, leukotriene inhibitors, and allergy shots. He also says that using a HEPA filter, washing your sheets frequently in hot water, and keeping pets out of your bedroom can reduce the need for allergy drugs. Veronique Provencher suggests you can turn off your phone and step away from the computer or TV screen during meals so you'll stay connected to your safety cues. Something else that may help, other experts say, is to become more aware of your portion sizes and what's in your food. And of course, exercising for 20 minutes a day, 3 times a week, will help you maintain. Anything that you could do more than that is just a benefit for you and your health. To read up more on the endocrine system and weight loss, please visit the references I have provided. Thank you for viewing.